Hello, I'm Dr. Shagufta, and today I'm going to talk about the current ongoing problems, that is the pandemic COVID-19 situation. Why do COVID positive patients have breathing issues and how can it cause death? Well, there are many different kinds of virus and coronavirus is one of them. Coronavirus is a kind of common virus that causes an infection in your nose, sinuses or throat. Most of the coronavirus are not dangerous. SARS-CoV-2 is one of the 7 different types of coronavirus, including the ones that cause severe diseases like MERS and SARS. COVID-19 is a disease caused by SARS-CoV-2 that can trigger the respiratory tract infection. It affects the upper respiratory tract, that is the nose, sinuses and throat, and the lower respiratory tract, that is the lungs and windpipe. The other coronaviruses that cause most of the colds that affect us during the year are not a serious threat for otherwise healthy people. It is very difficult to say if the patient is COVID positive or is suffering from common cold or flu unless the patient has fever and cough and lives in an area with virus or has traveled to places where the virus has spread. In healthy lungs, oxygen crosses the alveoli into the tiny nearby blood vessels known as capillaries. From here, the oxygen is transported to the rest of your body. But with COVID-19, the immune response disrupts the normal oxygen transfer. The white blood cells in the body release inflammatory molecules known as cytokines or chemokines, which in turn make more immune cells to kill the SARS-CoV-2 infected cells. As a result of this ongoing battle between your immune system and the virus, it leaves behind pus, which is nothing but excess fluid and dead cells, also known as debris in your lungs, thus blocking the air exchange and causing breathing difficulties. Worsening of shortness of breath can lead to a critical health condition known as hypoxia. When you can't breathe properly, it can cause your oxygen saturation level to drop below 90%. This can deprive your brain of oxygen. When this happens, confusion, lethargy, and other mental disruptions can occur. If the oxygen level dips to around 80% or below, then there is an increased risk of damage to your vital organs. You may be at a higher risk of developing breathing issues with COVID-19 if you are 65 years or above, if you smoke, or if you are diabetic, have COPD or cardiovascular disease, or if you have weak immune system. So my advice is to be safe. Always sanitize your hands or wash your hands as often you can, and also wear a face mask. Please try to change it every day. Do not keep using the same mask over and over. And also maintaining social distance, very important. Kids need to be very careful. Make sure they are at home and they are safe. Thank you so much. Take care.